Hystro মানে uterus, salpingo মানে salpinx is tube, graphy is what? It is radiographic intervention. So আমরা X-ray use করে we are studying uterus and fallopian tube with a dye. It's a radiographic evaluation of uterus and fallopian tube under fluorescence guidance. We are using a dye here. You should know what are all the indications. When will we do at what time will we do HSG? HSG আমরা কেন করি? Okay, না pregnancy patency, to check the patency of the fallopian tube. Any patient with, you remember A for anatomical distortion যদি থাকছে কিনা এটা জানার জন্য. Then for abortion, recurrent abortion, if there is any recurrent abortion, we have to rule out the anatomical कुछ মানে anatomical problem কিছু আছে কিনা ওটা জানার জন্য আমরা HSG করব. And for infertility, patient মানে she is married and she is not having child, okay, we have to rule out anatomical মানে कुछ ये আছে কিনা causes কিছু আছে কিনা, to rule out that we will do HSG. And after OT, কি OT আমরা করি? See, after ligation হয়ে গেছে, after ligation if the patient again wants to conceive, what will we do? After family planning, ligation হয়ে গেছে, ligation পরে আবার যদি patient বাচ্চা চাইলে কি করব আমরা? There's a surgery for it, okay, that is called tubal recanalization. Okay, টিউবস যেখানে বাঁধা ছিল দুদিকে আমরা কেটে টিউবটা মানে recanalization করব. So after recanalization we do HSG to check OT is done properly or not. If again মানে this pathway is established, patency ঠিক হচ্ছে কিনা আমাদের দেখতে হবে. And there is something called microcert. Microcert is a contraceptive device which is inserted inside the cornua. ঠিক আছে, cornua আছে না, ওখানে ইনসার্ট করা থাকে microcert. So to check again যখন আমরা HSG করছি, we can see if it is inserted properly or not. So contraindication, when will we not do HSG? This you should know. When the patient is pregnant, when you suspect pregnancy, okay, because when the patient is pregnant you cannot push dye, embryo will get washed away. So for a suspected pregnant patient, if she is having active bleeding, ঠিক আছে, or periods হচ্ছে সেই time you cannot insert cannula. If she is having PAD, pelvic inflammatory disease, okay, if she is having any cervicitis or infections like that, আমরা নিচে দিকে dye push করব, that will spread inside the tube and it will go inside the peritoneal cavity, that will upgrade the disease or infection bed is away. So we will not do in PID. In suspected tuberculosis we will not do, ঠিক আছে. And if she is having any sensitivity to contrast allergy থাকলে আমরা করব না. If she is having any uterine or tubal surgery for last 6 weeks এর মধ্যে আমরা করব না, তারপরে আমরা করব. So how will you prepare a patient? HSG আমরা কিভাবে করব? First you will take the consent, okay, you will take the consent of the patient, you will explain the risk, কি কি রিস্ক আছে. পেশেন্টের ব্লিডিং হতে পারে, ঠিক আছে, pelvic inflammatory disease হতে পারে, ইনফেকশন হতে পারে, আর অ্যালার্জি হতে পারে. এগুলো বলে আমরা কনসেন্ট নিয়ে নেব, ঠিক আছে. দেন উইল মেক দ্য পেশেন্ট লাই ইন ডর্সাল লিথোটমি পজিশন. ইয়েস, পেশেন্টকে ডর্সাল লিথোটমি পজিশনে দিয়ে তারপর ড্রেসিং ড্রেপিং এরিয়া সব স্টেরাইল করতে হবে, ওকে. দেন আমরা কি করব? উইল ইনসার্ট এ স্পেকুলাম. সিম স্পেকুলাম ইনসার্ট করে উই উইল হোল্ড দ্য অ্যান্টেরিয়র লিপ অফ দ্য সার্ভিক্স. অ্যান্ড দ্যার ইজ সামথিং কল্ড লিচ উইলকিনসন ক্যানুলা, আই উইল শো ইউ, ওকে. ক্যানুলাকে আমরা ইনসার্ট করব স্ক্রুইং ম্যানার, ইনসার্ট করে ইট মানে সার্ভিক্সের মানে এরম ঢুকে দেব. দিস ইজ সার্ভিক্স, ওকে. লিচ উইলকিনসন ক্যানুলা উইল বি হিয়ার অ্যান্ড উই উইল অ্যান্টিভার্ট, ঠিক আছে. নর্মালি ইউট্রাস ইজ হোয়াট? অ্যান্টিভার্টেড, ওকে, এরম থাকে. Uterus is like this. After inserting the cannula, we will do like this, antivert, so that the angle becomes straight. If it is straight, straight like this, no, dye will not reach up. So to activate kore, you have to push the dye. How much dye we will take? We will take 10 ml. So you will take 10 ml. What dye will we use? We will use water soluble dye. It is called Iohexol. And why do we take 10 ml? ঘুম পাচ্ছে কিছু তো কথা বল জানো না why don't we take 2 ml আমরা 10 ml দিই কেন 20 ml দিই না আমরা because the uterine cavity or volume হচ্ছে 3 ml okay 3 ml to distend the uterine cavity and for tubes it is another 3 ml 6 ml okay another 4 ml to push the water away to spill it in the peritoneum spillage সব কিছু আমরা মানে দেখতে হবে না so for that only we use 10 ml this I have told what are the complications after this procedure before doing this procedure no আমরা একটা antispasmodic injection বা tablet দিতে হবে Drotin after giving that কি ওরা we have to give an antispasmodic injection to prevent pain okay because it causes stretching of the cervix and uterus that will cause pain that might cause vasovagal attack also sudden pain mane whole patient will have a vasovagal attacks you can go in for syncope also ঠিক আছে so there can be bleeding because mane আমরা ali se dorchi we are distending the cervix okay and we have to pull also that can cause bleeding infection allergy to bolechi and it may cause uterine perforation yes first initially they were using a lipid soluble dye that is called lipidol okay it has 40% iodine in poppy seed that is manufactured by Gilbert now we are using water soluble contrast media that is Iohexol you must know that only this is not needed why do we use Iohexol because ampullary rugae are visualized clearly okay there is no granuloma formation pain আছে but কম থাকে and the demonstration is easy and clear see these are all the instruments that we use that is Leach Wilkinson cannula pointer আছে এটা দিয়ে this will go inside the cervix this end we will attach the syringe 10 ml syringe and from this end we will push the dye it will go here and it will fill the uterine cavity okay first what we do we will insert this speculum this Cusco speculum we don't use we use a sim speculum this sim speculum তারপর tenaculum দিয়ে আমরা anterior lip কে ধরবো Hegar's dilator we use if the os is closed tightly closed থাকলে we have to dilate little bit so that we will use that and after that we will insert the Leach Wilkinson cannula what are all the different types of cannula that we use Leach Wilkinson cannula you should know this will come as an MCQ also apart from that we use Acon tip metallic cannula cervical vacuum cup and balloon catheter or pediatric Foley's also but most commonly we use Leach Wilkinson cannula this is what we did this is cervical vacuum cup cannula this is Acon tip this is balloon catheter okay so how will you this is HSG how will you understand a normal HSG Hysterosalpingography okay see we can see this is the cannula after we are this white color is the contrast medium see we have spilled the contrast medium okay this is the os আছে and this is the uterine cavity this is the uterine cavity তারপর see the tube যাচ্ছে this is the tube see দুদিকে টিউব হচ্ছে okay টিউব থেকে বেরিয়ে spillage হচ্ছে this is spillage this is the tube track of the tube so what you should know is there is a triangle inverted triangle with base above and tip below this will be the normal anatomy this is the normal anatomy of the uterus and there is bilateral spillage got it at least you will have to take 4 films first initially this is the initial filling phase early filling phase okay see you have inserted the dye has went inside the tract it has started filling অল্প ফিল শুরু হয়েছে তারপর uterus ডিস্টেন্ড হয়েছে ডাইটা শুরু হয়েছে, তারপর ইউট্রাইন ডিস্টেনশন হয়েছে, ঠিক আছে, তারপর টিউবাল ফেস, ইউট্রাস থেকে আবার টিউব থেকে যাচ্ছে, ইট ইজ গোয়িং টু দ্য টিউব, then there is peritoneal spillage from the tube, no, it has come and it has spilled over the peritoneum, পড়ে গেছে পেরিটোনিয়ামে, টিউব থেকে ফিমব্রিয়া আছে না, ফিমব্রিয়া থেকে লিক হয়ে যাবে, বেরিয়ে আসবে, বেরিয়ে এলে আমরা বলি টিউব ইজ প্যাটেন্ট, or if not the tube is blocked, ঠিক আছে। what and all can you see, ইউট্রাসে কি কি দেখতে পারি, টিউবে কি দেখতে পারি, ইউট্রাসের কিছু অ্যানোমালি থাকলে বা if there is any intra abdominal মানে ইউট্রাইন মাস ফাইব্রয়েড আছে কিনা দেখতে পারবো, অ্যাডিনোমায়োসিস, কিছু পলিপ আছে কিনা দেখতে পারি, টিবি আছে কিনা, সার্ভাইকাল ইনকম্পিটেন্স আছে কিনা, টিউবের ব্লক আছে কিনা, স্প্যাসম আছে কিনা, টিউবের কিছু পলিপ আছে কিনা, হাইড্রোসালফিংস ইজ ভেরি ইম্পর্টেন্ট, ঠিক আছে। what is SIN, salpingitis ischemic nodosa, it is most common in tuberculosis, তারপর adhesions আছে, টিবি আছে কিনা এগুলো দেখার জন্য, this is not needed. See, this is a defect, this is an air bubble, okay, that is a normal finding, need not worry. See, there is an air bubble also, এখানে একটা air bubble আছে, okay, this is not important. এখানে this is cervical glands আছে, okay, these are all normal findings, they are saying this is normal findings. See, এখানে একটা নিচ আছে, uterine cavity is there, but here there is a nick, that shows there is cesarean scar, আগে একটা সিজার হয়েছে, ওই স্কারের জন্য একটা we call it isthmosil হয়েছে, for because of that there is a nick. See, this is the cannula, see, you can see the cannula, Leach Wilkinson cannula tip, it has inserted inside the cervix. See, there is fully distension, uterine distension হয়ে গেছে, একদিকে there is, this is right side there is spillage, tubes is patent and there is spillage in the peritoneum, but left side there is no, left side there is block, ঠিক আছে। so how will you say, if they give you মানে এরকম একটা ছবি দিয়ে দেবে, how will you describe it, you will say sir this is a sciogram because it is an x-ray, or it is a sciogram or an x-ray showing his hysterosalpingography, there we can see uterus is fully filled, there is spillage on the right side with block on the left side, ঠিক আছে, understood? See, এখানে bilateral fill, this is a difficult thing for you, this is the মানে uterus একটু এদিকে হয়ে গেছে because of adhesion or something, if the tract is here, this is the uterus, there is bilateral block, uterine anomalies আছে অনেক টাইম, ঠিক আছে, unicornuate uterus, bicornuate uterus, bicolpos, তারপর arcuate uterus, এগুলো টাইপস আছে, you should know just little bit, okay. See, এখানে একটাই কর্ন আছে, see this is unicornuate uterus, see একটাই কর্ন আছে, see একটাই কর্ন আছে, অপোজিট উল্টো দিকে একটা হর্ন যেটা আছে that is not developed, either it can be not developed or it cannot be rudimentary মানে there is no connection here, so the dye did not go here, the dye has only entered here, see একদিকে dye enter হয়েছে, spillage আছে, ঠিক আছে, that is the uterus, that is the spillage, unicornuate uterus again, see there is spillage, right side horn is there, right side spillage is there. This is also unicornuate uterus. See, this is uterine diadelphys, মানে দুটো কর্ন আছে, uterus diadelphys মানে everything is two, দুটো vaginal cavity, একটা vagina, এখানে একটা vagina, দুটো cervix আছে, দুটো uterine horn আছে, দুটো tube আছে, everything is two. This is uterine diadelphys. See, there is two cervix, এখানে একটা cervix আছে, এখানে একটা cervix আছে, তারপর এখানে একটা কর্ন, এখানে একটা হর্ন, there is spillage here, tube is going here but spillage is not there, but still here it is there. This is uterine diadelphys as I told, this is bicornuate unicollis, Unicollis. Collis means vagina. See, there is one vaginal cavity. There is only one cervix, bilateral. মানে horns আছে the same bicornuate uterus. You should know how to differentiate bicornuate uterus from septate uterus. See, imagine if there is a septum in between. যদি একটা septate uterus থাকলে it will be like similar. If there is a bicornuate uterus also it will be similar. আমি ছবি দেখাবো. Okay, in bicornuate uterus there are two horns. এখানে একটা horn আছে, এখানে একটা horn আছে. Okay, and this angle, no, it is more than 100 degree. Intercornual angle is more than 100 degree. But in septate uterus, angle is not obtuse, it is acute. Okay, this is an obtuse angle, more than 60 degree, 100 degree, more than 100 degree also. But in septate uterus, it is acute angle. See, uterus diadelphius, I told everything is 2. Uterus bicornis, bicollis, there is 2 uterus, 2 cervix and 1 vagina. Because this is T-shaped uterus. T-shaped uterus you will see in intrauterine exposure to diethyl stilbostop. This is arcuate uterus. Arcuate মানে এখানে একটা arc আছে। এগুলো তো বেশি ইম্পর্টেন্ট। See, this is septate uterus. এখানে একটা septum থাকে। See, there is 2 uterine cavity. But the angle is acute. It is less than 100. See, it is less than 100, acute angle. But you imagine, no, if you have the HSG, you, ওটাই বলছি, you have to differentiate between bicollis and septate uterus. Yes, আমি কি বললাম, bicollis এর অ্যাঙ্গেলটা more than 100, it is মানে intercornual অ্যাঙ্গেলটা বেশি আছে, এখানে কম আছে, দেখ। See, this is also septate uterus. Septate uterus কে তুই দেখে জান, মানে বলতে হবে কি ডিফারেন্স কি আছে বল। bicornuate, the fundus is indented, angle is more than 100 degree. Here normal external surface cavities are closer, okay, and the angle is obtuse. This one you have to know. HSG we cannot differentiate, we should use an MRI or 3D ultrasound to differentiate. Okay, in bicornuate uterus the intervening cleft is more than 1 centimeter, intercornual distance is more than 5 centimeter. Okay, intercornual distance যেটা আছে, if it is more than 5 centimeter in bicornuate uterus, ঠিক আছে। This is adenomyosis. Adenomyosis you cannot differentiate, এটা তোমাদেরকে দেওয়া হবে না। Okay, see, এখানে একটা ডিফেক্ট আছে। Okay, that is because of fibroid. This is not important. Salpingitis, Hysterosalpingography nodes are not important for you. See, there is node like structures here, ঠিক আছে, এখানে নেই। This is salpingitis, Hysterosalpingography nodes, multiple outpouching from the isthmus. There is something similar called this we call as beaded appearance. Beaded appearance, this we see in TB, that it will come. Okay, see, এখানে মানে unicornuate uterus আছে। Okay, unicornuate uterus with single horn. See, there is spillage on the right side, the tube যাচ্ছে পড়ে গেছে। See, this one, this is also a tube. What are the parts of tube? Tube এর parts কি কি আছে? Isthmus, interstitium, fimbria, ঠিক আছে, this is fimbria, this is the ampullary area. Okay, so in this na the ampullary area is swollen because of some infection হয়ে এর ভিতরে জল জমে আছে, hydrosalpinx. Okay, full আছে টিউবটা, so in that space the dye has filled the cavity. দুদিকে একটা pouch appearance আছে না, this is hydrosalpinx. I got this question in my NEET, আমার NEET বুঝিতে hydrosalpinx এসেছিল। See, right side hydrosalpinx, left hydrosalpinx. This is the same. See, এখানে একটা filling defect আছে, this is a tubal polyp. This is a left sided hydrosalpinx. Okay, and right side দেখ এত দূর গেছে, তারপর যায়নি, there is no spillage, মাঝখানে আটকে গেছে, that means মানে ligation হয়েছে। See, এখানেও যাচ্ছে আটকে গেছে, এত দূর যাচ্ছে আটকে গেছে, দ্যাট মিনস লাইগেশন। ওকে, সে এখানে একটা adhesion হয়েছে, this is not important. সে মাঝখানে there is a সাইনাকে or adhesion, এখানে এত বড় স্পেলিং ডিফেক্ট আছে, বাকি সব জায়গায় গেছে, but there is an adhesion here. What do we call it? We call it Asherman syndrome. Yes, in Asherman syndrome there is সাইনাকে, uterus adhesion আছে. So here also there is multiple সাইনাকে, filling defect আছে. Sometimes no, when we inject dye, there will be corneal spasm. Tube might be healthy, but because of the pain, there will be corneal spasm. We will মানে এটা আমরা মানে we might think that it is a blockage, but because of corneal spasm also it can happen. Dedicate tubal ligation হয়েছে, and about TB I have to show you. Tuberculosis কি findings আছে? This is very interesting. Okay, see, this is tufted tube appearance. এখানে একটা rosette shape এ আছে. Okay, this is rosette appearance in TB. What is this? Salpingus isthmitis nodosa. It is similar like that. See, this is cotton appearance. Cotton will plug like a cotton. See, cotton will plug appearance. This is beaded appearance. Bead such a. See, similar. This all you will see in TB. This is a golf club. See, similar like this. No, it has thickened. Thick for একটা bead আছে. This is golf club appearance. Okay, and this is a pipe. See, it is also similar like a pipe. Pipe appearance, floral appearance. Okay, leopard skin appearance. দেখ এখানে একটা টিউবের মাঝখানে একটা ফিলিং ডিফেক্ট আছে because of adhesion. এখানে adhesion আছে, এখানে ফিলেজ হয়েছে. This is leopard skin appearance, cobblestone appearance, corkscrew appearance. See, এরকম যাচ্ছে, whirled out. This is tobacco pouch appearance. See this one. এখানে একটা golf club appearance আছে. This is also golf club appearance in intrauterine DES exposure. Okay, this is trifolate. Trifolate is TMC Rihanna logo na? Similar no? See, এখানে it is like this.